Clinical Officer at Dandelion Medical Center. So I'm going to take you on family planning, cervical cancer screening, and HIV testing. So first you're going to start with family planning. What is family planning? Family planning is planned spacing of children, but generally we are going to talk on the perspective of youth. This it prevents unintended pregnancy. So what do I mean by the importance of family planning? First, family planning prevents unintended pregnancy. So another thing, it supports education and career goal. When you use family planning, it really helps when one will get the correct way of education, will not maybe drop out of school because of maybe an intended pregnancy. So another thing, it reduces health risk. Normally, the young pregnant mothers, normally they are exposed to different risk factors during pregnancy, maybe in having a high blood pressure among the youth, also diabetes. Yeah. So another thing, it promotes responsible decision making. What do I mean by responsible decision making? This means this is safe sexual behavior and respect of consent. So this means that the youth can get the chance to have their own decision making of having a certain family planning. Normally, we have challenges for family planning again amongst the youth. The first challenge is limited access to youth-friendly services and youth-friendly centers. So another thing is lack of comprehensive sex education amongst the youth. Another thing is misinformation and fear among the about the family planning among the youth. We are having different types of family planning. Generally, we are going to do with a family planning that is in Kenya. So we have a hormonal type, we have non-hormonal, and we have the permanent type of family planning. So we are going to start with the hormonal type of family planning. The first is normally the injectables. So the first, we have the Depo-Provera. I think we're having, this is normally one male Depo-Provera that is normally given IM. What I mean by IM is normally given intramuscular, can be given on the deltoid. Yeah. So this takes 3 months for the half-life of this to be over. So when you're given this jab, you take 3 months, then you come for another jab for the next 3 months. So another thing, we are having we normally call it the COC. This is combined oral pill. What I mean by combined oral pill, normally it's normally a 28-day pill. So as you can see, it's 28 pills. So you take it from, depending on the number, it is normally rated where to start. This is where you start and you go until the 28th day. And this is normally also used to regulate hormones. When you're having hormonal imbalances, this is also what you have to take for the next 28 days. It is safe. So another oral contraceptives is also the progesterone. We're having the progesterone pill, but normally this other pill is normally for the lactating mothers. So they normally take this to prevent the mother to have enough milk for the baby, because if you know, this family planning are just hormonal. Some may reduce the rate of milk production in mothers. Yeah. So another thing, we are having implants. We are having different types of implants. We are having a 3 years implant. It's normally called a Implanol NXT. It's normally given under the skin, normally on the hand, on this here is normally given. So normally we just put lignocaine. What I mean by lignocaine is just local anesthesia. So it's normally injected there, then it stays just beneath the skin, not in the muscles. So this is a 3 year, and it's normally one implant. Yeah. So another thing, we are having another one which is called Jadel. Jadel is a 5 year implant. Normally you can see it is two rods. It's also given just beneath the skin also, but it goes for 5 years. The difference between Jadel and Implanon, the other one is 3 years, which is one rod, and the other one is 5 years, which is two rods. The next one is emergency contraceptive pills. This is normally taken 72 hours after the sexual intercourse, before the 72 hours of the sexual intercourse, to prevent pregnancy. Yeah. So another one is IUCD. We're having an IUCD that is hormonal, normally known as Mirena. It takes 10 years, which is normally placed on the woman's uterus. Yeah. So we will go directly to the nanomonal. We'll start with condom. Condom is normally the safest, and it prevents a spread of STIs, and also prevents pregnancy.
Aya, ukitaka kufungua unaangalia mali inakaa hivi. Umeona hivi side. Alafu unashika hii tip ya juu, sawa? Hapa juu, unaona nani nimeshika hapa juu? Alafu huwezi weka kama Mr. John amekufa. Ndio maana sasa ile amesimama hapo, sawa, ameiva. Aya, sijui. Alafu unaona hii imebaki. Hapo walasa ukishamaliza shughuli, Mr. John anapanga, anarudi tena vile alikuwa. Alafu ukishamaliza unashika hapa chini. Unaona hapa? Unailenye tu polepole. Alafu una make sure hapa juu umeshika. Alafu una nini vizuri. Lasi unaona hii yenye ulitoa. Una make sure umekunjanisha vizuri. Umeiweka vizuri, naenda kutupa kwa choo ile shimo ya nje, si ya.
Another thing is IUCD, that is copper T. That one is just nanomonal. It's normally placed on the woman uterus to prevent a woman to get pregnant. So another type is permanent method. We're having two types in permanent methods. We're having the bilateral tubal ligation and vasectomy. So bilateral tubal ligation is normally for the women, and vasectomy is normally for the men. This is normally permanent. This is irreversible. When you do this, you can't reverse it back. I'm going to deal with the side effect of family planning generally. First, what I can mean by the side effect, different side effects depends with different body, depends with different person. Yeah. So, but we're having a general side effects. Normally, the major general side effect is normally the irregular bleeding. Normally, when you introduce the hormones to the body, normally some people may get heavy bleeding, or even some people cannot get the periods for even till they stop using the family planning. So also it may lead to, maybe due to the hormonal imbalances, it can lead to weight gain and weight loss. So I'm going to talk generally about the emergency contraceptive pills. Normally, it's normally encouraged that not you should not take more than two. It's normally two in a year for the whole year, for the P2, because when you take these emergency contraceptive pills, it normally causes issues of fertility in the near future. Okay. Normally, I'd really encourage the youth to take the long-term family planning. What I mean by that is normally the 2 years, the 3 years, and the 5 years implant, because they're having the low content of the medicine in it, of the hormones that prevents pregnancy. So it's normally very safe, and it's easy when you just get rid of it. You'll concept the conception will take in very easily. And also for the we encourage also them to use the nanomonal. What I mean by nanomonal is the condom and the IUCD, because it is just a way that is just, it's a barrier to prevent a fertilization to take place in the body. So on the myths about family planning, the first myth is we normally say family planning causes infertility. This is just a myth. Most family planning are reversible, only except for the permanent methods. So those are just myths. So another thing, there is a myth that is said that family planning is only for the married people. No, family planning, even the youth can take family planning for them to have the correct way of having their education and not dropping out of school. Another thing, we normally say that family planning, when you use family planning, it causes irresponsible sexual behavior. No, family planning normally just prevents pregnancy, but does not cause the sexual behavior. So another thing, it's normally said family planning is only for the woman. No, family planning is not only for the woman. Family planning can be used by both the male and the female. We are having the condom for the male, and the other ones, which is the other family planning that can be used also with the female. Next, I'm going to talk about a cervical screening. We normally do cervical screening to detect maybe the human papilloma virus or any form of microbes that is normally in the cervical region. So if you can know, cervical cancer is the leading cause of death among the women currently in the world. First advantage is early detection of precancerous that causes the HPV, which is the one that causes the cervical cancer. What I mean by cervical cancer screening, the HPV is normally contracted sexually. So you can get the HPV through sexual activity. So we are going to talk about the screening method. Normally we have the VIA. What I mean by VIA is a visual inspection of the using the acetic acid and also the pap smear. Normally among the youth, we normally encourage them to use the visual inspection of the acetic acid. So when you want to locate the cervix, you normally use something known by the name speculum. This is how the speculum looks. Normally, it's normally put on the woman's vagina. It is placed inside. Then it's normally open to visualize the cervix. Now that is when you'll place the acetic acid on the cervix to get to check on maybe there is any form of the human papilloma virus. Normally the pap smear is normally done in labs, but it's normally done for mothers who are over 50 years and above. This is because their cervix is normally getting inside, so you can't visualize it. That's why we use the pap smear. Yeah, and in case of any case of a positive visual inspection with acetic acid, we normally do a pap smear to confirm. Next, we do a biopsy to confirm maybe if there's any form of cancer.